All right, so I thought I'd make a quick video on using patient-first language, kind of what it means, how to incorporate it into practice, and then why it's an important thing to incorporate into practice. So patient-first language basically is the concept that we should put our patients and who they are as a person and an identity before their diagnosis. So instead of saying my low back pain patient or the stroke patient, you would say my patient with low back pain or Mrs. Smith who had a stroke. And so what that does is it puts the patient and who they are as an individual and as a person before the diagnosis that we're seeing them for. And this is important because it not only sends a message to us and other healthcare practitioners, but it also sends a message to the patient that we care about who they are, who their or what their values are, what their beliefs are, what their goals are before what their diagnosis is that we're treating them for or whatever condition they have. Because especially with patients who have longer term illness or injuries or diseases, that becomes a bigger aspect of their lives. And the fact that they're seeing us for their condition already tells us that whatever their condition is already a big enough point in their life that they have to go see somebody about it. And if we put that before we put the patient, it dehumanizes the patient and their experiences compared to the condition. And if you've gone your entire life being referred to as the spinal cord injury, that's a lot different than if every practitioner you had seen had said, oh, hey, Mr. Jones, who has a spinal cord injury, because they're a person before they are their diagnosis. Their diagnosis does not define them and who they are. And I think it's important, especially for us as physical therapists, because we do have so much one-on-one and face-to-face time with patients. Particularly compared to maybe the MDs or the PCPs, we get to see patients a lot more. We are kind of a more face-to-face representation of the healthcare system as a whole. And if we can use patient-first language and refer to them as individuals who are humans, no more, no less than we are, before we refer to them as their diagnosis, we can give them some of their humanity back and give them their life and their individualism over their diagnosis or condition, which is a really powerful and empowering thing. And that also helps us to build the therapeutic alliance and connection, which we know can also help with our treatment. And that's important kind of for the reasons we already mentioned. And I think that it's important as physical therapists that when we're documenting or when we're talking to other healthcare practitioners, that we still maintain that patient-first language, because it not only does it further embed the concept and the idea of people and patients above their conditions within our minds, it also helps spread that concept to other healthcare practitioners that maybe haven't had exposure to what patient-first language is or are not using patient-first language. And to implement it, it's as easy as it sounds. It's just putting the patient, who they are, and the fact that they're a person before their diagnosis. So my person with low back pain, or Mr. Jones who has a spinal cord injury, rather than my low back pain patient or my spinal cord injury patient. And that's as easy as it gets in terms of implementing something. It's just a quick flip around of words. And it can really have a big impact, not only on how we see our patients, but how our patients see themselves. And it's something that takes a little bit of thought and attention to in the beginning, especially if it's something you're not used to doing. But once you've been doing it for a little while, it kind of just comes naturally to say the patient with this condition, or Mrs. Smith who has low back pain. And it's a really powerful and simple tool that I think physical therapists can use to not only empower patients, but let them know that we care about who they are as an individual and what their goals and dreams and aspirations are, more so than we care what their diagnosis is. And obviously we care about what their diagnosis is because we're thinking about how we can best provide care for that patient. But at the end of the day, the patient comes before their diagnosis. And for everyone that's super evidence-based, which every therapist should be, we can't forget that patient values and beliefs and who they are as a person is an entire part of the evidence-based practice stool. And patient first language is an easy step to incorporating that into evidence-based practice. Thanks for watching. It's a quick video on patient first language. Hopefully you found it helpful and enjoyed it, and try and start using that in your practice. I think it'll make a subtle but a big difference in our patients' lives and the healthcare system as a whole. Thanks for watching.